sleeping with their mouth open, they're waking up because they're dehydrated. There are some really simple, gentle craniosacral techniques that you can use to help open up the airways and help your child breathe better. So I'll show you on my skull first. So we have a whole bunch of bones. You have to remember that on infants and toddlers, you still have your frontal dip here, an opening, so you stay away from there. But what you want to start with is, it's like you're trying to suction the frontal bone. So this bone right here, you're going to try and gently lift it anteriorly. This is going to help create space in the cranium. Then you see here along the sutures, you've got your parietal bones, and you're going to put your hands and you're trying to facilitate, the intention is to expand the parietal bones. And it's usually, it looks like this, and you imagine that your hand is like an octopus tentacle and you're trying to suction the bone out. And so this is going to create more space through the cranium, which then enables you to come into the anterior of the face. And so here we have the nasal bone right here, this tiny little bone. And what you want to do is hold on to the frontal bone, so just above, and then pull. And the intention is to pull out and a little down, so with the line that the nasal bone is already in. And so if you were to try it on yourself, you're going to hold here, and very gently you're pulling your nasal bone anteriorly and a little down. So I recommend you do that, and you hold these for about 60 seconds, 90 seconds. And then you're going to go to the zygomatic arches right here, and you're going to apply a lateral tension. So you're going to be pushing them out. This should be completely pain-free, totally gentle. And I tell you, if you do this, I've done this to my well, she's now 5. I've done this to my 5-year-old when she's sleeping. She was congested, and so she was snoring. And so I did this whole little sequence. It took like maximum 4 minutes, and then her mouth closed and she was breathing through her nose and she stopped snoring. So this is a little routine that I'd like for you to try. If you're not comfortable with it, which is completely okay, I recommend you find a craniosacral therapist or a manual osteopath to help guide you through this little sequence, and maybe have them do it on your child. It'll help with their respiratory. They'll be able to inhale with greater ease, and it helps with drainage because it creates more space in the sinuses, and so they can start to recover a little faster. If you find this helpful, please like and follow, and we are here.